Communities need ambulatory care locations now more than ever, especially with COVID-19 patients taking up acute care space within hospitals. Where can other people go that is away from inpatient hospital campuses? Brick-and-mortar retail stores have been closing their doors at alarming rates due to the pandemic. As we all know, the trend of transforming old retail big box buildings into outpatient health centers has been on the rise for a while now. COVID-19 has just accelerated this trend by increasing the amount of vacant retail stores and increasing the demand for outpatient medical facilities. Since both increases go hand in hand, JPT is going over the best practices involved in designing outpatient healthcare facilities from existing big box retail stores. First, the opportunity is now. The brick-and-mortar retail industry has been headed in a downward spiral for some time, but COVID-19 has caused a major uptick in vacant retail stores which offer excellent framework for ambulatory care facilities. Next, site considerations need taken into account as most big box retail stores are located in prime real estate spots within the community that include plenty of visibility, branding exposure, and parking. Environmental contaminants are next, and examining the building's surrounding environmental contaminants is best done with a Phase 1 environmental site assessment. The building's state and history is essential, and the easiest way to find out about this is to get as many building drawings as you can find, especially a set of as-built plans. Additionally, program performance is important to consider and shows you what kind of medical equipment and setting that you specifically need. Whatever your specific healthcare needs, JPT suggests picking the facility that has the largest and most open layout. That way, you would be left with a blank canvas to fit your exact needs. Following is exterior walls, which need to be examined to see things such as loading capacities, insulation materials, and foundation limitations in order to determine the system loading capacities. Next is the roof, and when it comes down to it, you are most likely going to have to replace the roof and insulation as it is likely near the end of its life cycle. Although the existing bones of these vacant big box retail spots are usually pretty good, structural stability needs to be examined as retail stores are mostly designed to the code minimum structural loading criteria. Also, concrete inconsistency, distortion, and flaws need to be investigated while looking for leveling issues, cracks, settlement problems, wetness, dampness, and heaving. The HVAC needs of a retail store are much less intensive than the HVAC needs of an ambulatory care facility with medical specialties, and most of the time the HVAC system needs to be replaced. Additionally, the typical ceiling heights of a big box store are very high, which increases the cost to keep the room comfortably warm or cool. Since a retail store's plumbing needs may only be for 1 or 2 restrooms, an outpatient facility demands much more complex plumbing intricacies because it services patients, medical staff, and the public who may need more restrooms, plus sinks and exam rooms, maintenance staff closets, operating room needs, along with many more plumbing necessities. With hospitals being one of the largest power consumers on the planet, outpatient healthcare facilities also require a massive amount of power, especially when comparing it to a retail store. An electrical engineer is needed to evaluate the current electrical service equipment to see what its functioning capacity is. Backup power should be considered when you are evaluating and adapting the existing electrical switchgear. When you are thinking about an outpatient surgery center, the need for backup power is greatly increased. Next up is the building's fire protection system, which could already be in place. If this is the case, then a fire protection engineer would only need to come in and see what, if anything, is needed. If there is a need for a new fire protection system, the building needs a new water source and a new fire sprinkler room. One of the most attractive things about vacant big box retail stores is that they come with parking lots most of the time. An evaluation should be carried out by an engineer on the parking lot to confirm its efficiency, along with checking it against ADA conditions to see whether those conditions require additional parking or other needs. Ambulatory care centers that have been revamped from vacant retail stores are typically located in well-traveled and populated areas within the community, are near highways, are easy to access from the road, and is on the local bike route. Also beneficial is to make sure the building is near and equipped for those who ride a bike or walk. Schedule and budget are two of the main project priorities that the city approval process can impact, so facility leaders need to see how the property is zoned and what the permitted uses are, in addition to bringing a local and knowledgeable civil engineer into the mix. Telehealth has been in popular demand since before the pandemic started. To facilitate telehealth, include technology where it is needed, offer a supporting clinical model, provide access to care, and generate a reimbursement structure. Last, when selecting a building that has adaptability and is intended for long-term use, flexibility is an important factor in the long-term functionality of an outpatient healthcare building because physicians and their care delivery models change over time. Healthcare facility leaders should pick buildings based on future growth and expansion capabilities through adjoining space and take the structure's visibility and street presence into consideration. JPT Architects and Engineers thanks you for tuning in to learn about best practices when converting a vacant big box retail store into an ambulatory care center. Check out JPT's blog post that goes along with this video for more details on the topic. The fall of retail makes way for the rise of ambulatory healthcare. See you next time.